You're listening to the Dr. Cremata Show, empowering you to master healthy living by bringing you the latest research, expert interviews, and quick, easy tips you can incorporate into your daily life. The Dr. Cremata Show, not your ordinary health show.
Wow! I feel good. I knew that I wouldn't. I feel good. I knew that I wouldn't. So good. So good. I got you.
Good morning and welcome to the show. Today is the end of the quarter for the show, so it's going to be a little different approach. We're actually going to summarize the 5 factors of health that we've talked about, and we're going to summarize some of the information that has been offered to us by our experts and our guests on the show. And what I'm hoping to do is leave you with a podcast or leave you with a CD that you can burn and listen to on a regular basis to help you adopt all of these ideas that you've learned over the last quarter into your lifestyle. So it's going to be a little bit different. We're going to go through the factors of health. We're going to go through what the experts have taught us. And I want to leave you with some specific things to do that I can assure you will make substantial differences in your health and your life. Let's start with the 5 factors of health. Well, the number one thing is positive mental attitude, positive beliefs. You can refer to Dr. Lipton's interview where he is the gentleman, if you recall, the cell biologist that wrote the book, The Biology of Belief. And essentially what we've learned from him and from some of the studies that we've reviewed is that your mental attitude, how your brain functions, and your beliefs have a lot to do with your health. It isn't only chemicals that can affect the cell membrane or that can affect what genetics are expressed and such, but essentially you have to start with good mental attitude, good function within your brain, because keep in mind that this is what's going to control all of the cells of your body through the nervous system. So if you short out the brain, if you have abnormalities in brain function, all you're going to do is get that aberrant information out to the rest of the cells in an abnormal manner. So keep your mental attitude healthy. That shouldn't be that new news for anyone. Everyone knows that when you're unhappy, when you're unhealthy mentally and under too much stress, I think most of us can accept that that's just not a healthy way to live. The second concept, which I've tried to stress a lot during the show, not only because I'm a chiropractor, but because I think that chiropractic care is perhaps the least utilized necessary care out there from our choices. Only about 7% of the population go to chiropractors, even though a higher percent of populations, for example, people that have been in car accidents go. But chiropractic care is a lot of times understood. It's not really for the treatment of pain. It's really the treatment of joints, and particularly spinal joints. And by keeping your joints aligned, by keeping them moving properly, as we talked about last week during the show, it's going to help to keep your joints lubricated. It's going to help keep from getting arthritis. But as importantly, it's going to keep the joint alignment better so that misalignments of the joints and fixations and increased inflammation of the articulations won't interfere with the nerves that go through there. So we talked about the mental attitude. We talked about how important it is to get this brain healthy. It's just as important to be sure that all of that information gets to all of the cells of the body through the nervous system, so we can sense what's going on in our environment. All the nerves that go to the brain don't have any interference at the spine, and we can control our muscles and pump our heart and everything else through the nerves that go from the brain to the rest of the body. So that's what chiropractic care is about. And that's why we've reviewed studies showing that it helps anything from back pain to flexibility to irritable bowel syndrome to countless other conditions, bladder problems that we've discussed on the show. Now, the third factor of health is diet and supplementation. The amount of evidence and the amount of research in this is just absolutely amazing. And in the last quarter, we've been able to go through a great deal of it. The diet rules are really pretty simple. Look, what we're asking you to do is eat more fruits and vegetables. eat less processed foods like sugar and white flour, and be sure that you're cutting down as much as possible your animal proteins. So if you can cut down your animal protein, increase your fruits and vegetables, and cut down your processed foods, that is going to make huge differences in your overall health, and it's going to help you prevent getting some diseases. We recommended a book early on called The China Study, where a researcher basically was able to show a direct relationship in 42 years of research between the amount of animal products that you eat and your likelihood of getting cancer. So we're not talking about just changing your diet to feel a little better or to look a little younger. We're talking about changing your diet to increase the quality of your life and the quantity of your life. You're likely to live longer if you don't get deadly diseases. Now, on the other side of the coin, we have supplementation. There are those out there that feel, well, since I eat so well, I don't need supplements. And that is very far from the truth if you're interested in optimal health from nutrition, because there's only a certain amount of nutrients and a certain dose, in a sense, of nutrients that you can get from your fruits and vegetables in a good diet. But to get the therapeutic doses of things like coenzyme Q, to get the therapeutic doses of omega-3s, the amount of fish that you would have to eat or the amount of fruits and vegetables you'd have to eat is nearly impossible. So the recommendation here is to make sure you make the dietary changes we talked about. They're simple, just more fruits and vegetables, less animal products, less processed foods. We're not asking you to be, a monk or be religious about it, but just to go that direction and to take a good dietary supplement. For information on this, I believe the best dietary supplement available at the best price you can find on my website at drcremata.com, DRCREMATA, and it's on the diet supplementation tab. The fourth item is exercise. This one we don't need to spend a lot of time on. I think most of us are aware that exercise is important, but I would recommend that you go back and listen to Dr. Plogger, listen to Dr. Gelfand, and listen to the experts that have talked about how to exercise and the importance of exercise. And remember, during Dr. Riopel's interview, that we reviewed articles that show that appropriate exercise on a regular basis can actually help you age slower, so that you end up living essentially about 12 years longer. And the study that we went over had to do with not only living longer, but feeling younger, basically reversing the signs of aging or slowing the signs of aging. So exercise is critical to keep your weight down, maintain your sugar level, helps you look good, helps you with anti-aging, but more than anything else, it helps you prevent diseases like cancer and heart disease and metabolic diseases such as diabetes. So another critical one. Lastly, lifestyle choices. And this one, I admit is kind of obvious, but some people don't realize how important lifestyle choices are as the fifth factor of health. And the important thing to remember here is, look, don't smoke, keep your stress level down, take time to relax. Don't be so busy exercising and doing so many other things that you don't take time to just relax and take same time to meditate, to pray, to rest, to take walks. So lifestyle choices include things like, above like you eat, but also critically important things like not smoking. Okay, we're up against a quick break here. So we'll be back in just a few minutes with more of the Dr. Cremata Show quarterly summary.
Hi, this is Kimberly, and I adopted my two best friends, Benny and Tommy, from Tri-Valley Animal Rescue. Tommy's blind in one eye and can't hear, but he's perfectly fine to me. And Benny, well, he's like a big soft teddy bear. So when you're ready to adopt an animal or even volunteer for a few hours, call Tri-Valley Animal Rescue in Dublin or go to petfinder.com. They all deserve a second chance.
Welcome back to the Dr. Cremata Show. You're listening to the quarterly summary, and I would like to refer you to my website at drcremata.com, DrCremata, where you can listen to the long version of the podcasts of the 12 shows that we're summarizing. But since there is a lot of information and you may have missed some of these shows, what we're trying to do today is kind of give you the highlights and the summaries of what you should be implementing in your life. But again, the website, if you go to the radio show tabs, any particular subject that you're interested in or a reference that you might want, the website is where you would go to get this information. So during the first segment, we talked about the 5 factors of health, how important positive mental attitude and beliefs are, how important chiropractic care is, and how misunderstood chiropractic care is in the population. And we talked about diet, and we also talked about supplementation, and basically concluded that a good diet is critically important and supplementation is critically important. One does not make up for the other. You really need both. We then talked about exercise, how not only does it help you age slower, but it helps you live longer, prevent disease, and I think it keeps you much happier and healthier in the process. And lastly, the 5th thing we talked about is the lifestyle choices, and of course things like, smoking or excessive drinking and not taking time to rest and relax are things that are going to interfere with your health and happiness. Now, let's look at healthcare choices that we need to make. We know that every expert that we've had in this last quarter talked about always starting with the most conservative available treatment for a particular condition and then moving to the most aggressive. So let me give you some examples to make sure that we really have that down. But for example, we've had a couple of emails come in talking about menstrual cramps. So if you have menstrual cramps, there are numerous causes for menstrual cramps. Some of them are mechanical, something within the pelvis or in the low back. Some of them are neural. There's a nerve that's being irritated in the low back. Some of them are hormonal, where your hormones are out of balance. And sometimes menstrual cramps are caused from a specific disease, like a fibroid tumor or endometriosis, where you're best off seeing a gynecologist to diagnose those things and address them. So with menstrual cramps, you make a list of what the possible causes and treatments are, and the most conservative approach would be visit a chiropractor. There are abundant studies showing that chiropractic care has been helpful with some cases of menstrual cramps. And of course, these are more likely to be the patients that have menstrual cramps from a subluxation or a misalignment of the pelvis or of the low back, and particularly some that might be affecting the nerves. So chiropractic care would be number one place to start because it's so conservative and safe and effective. Second thing you'd want to do is add supplementation. Again, getting on a good supplement, making some dietary changes is a very conservative, inexpensive thing to do that's likely to help you in other areas as well. And there are abundant studies in the medical literature showing that dietary supplementation not only helps with menstrual cramps, but also helps with PMS. And some of these menstrual syndromes include mood disorders, and very often whenever I talk about supplements for PMS and menstrual cramps, it's usually the men that jump to the website and send me an email and say, hey, send me everything you got. But in all seriousness, the nutritional thing is and the supplementation is extremely important and very conservative. Third, I would recommend that you see your gynecologist. It's very, very important to be sure that you don't have a pathology like endometriosis or fibroid tumors or some other cause of your cramping and maybe the associated excessive bleeding. So that's obviously very important. And if it's a hormonal problem that you have causing your cramps, go back and listen to Dr. McCrory. Dr. McCrory was one of our guests, and there's a podcast on my website, and he practices in Roseville. So if you believe that it's a hormonal problem, he would be an example of a doctor that could adequately diagnose it and give you the appropriate treatment to balance hormones. What if you have low back pain? Again, conservative to aggressive. You start with the conservative providers. You might start with even simple things at home. You might start with exercise programs, avoiding lifting and things that you know are bad. Then you're going to progress to seeing a chiropractor. There's no question that for low back pain, chiropractic care has been found to be the most effective and the safest approach for chronic low back pain. That's about 40 or 50 randomized controlled trials, including recent studies that we discussed on this show with our neurosurgeon, Dr. Lieberson, which we'll talk about a little bit later. So you'll start with that, and then there's intermediate procedure. So if you go to a chiropractor, you have exercise programs given to you by the chiropractor, and that doesn't have the effect that you want. There's procedures in between before you should consider surgery. And again, most spine surgeons would agree. The procedure that I like the most, that's extremely effective, when you've had low back pain that has not responded adequately with your chiropractor in the office, then the next place to go is to get a consultation for fibrosis release procedures, including manipulation under anesthesia. A little more aggressive than the in-office care. So you're not going to want to do this for every case. You're not going to want to start with MUA. You're going to want to start with in-office care. Most people won't need the fibrosis release procedures, but always consider fibrosis release procedures, including manipulation under anesthesia, before you consider surgery. This is consistent with our conservative to aggressive approach. And then if you think surgery is the best way to go, keep in mind you're always going to want a second opinion. You're always going to want to make sure that you're seeing a chart that has done a lot of these conditions and can guide you regarding the most appropriate, the most conservative approach for your particular problem. A third example of how you might approach this conservative to aggressive approach to your healthcare choices, which is really the most intelligent way to go for all conditions, is a very common condition, lateral epicondylitis. I'm still getting emails and phone calls. What about my tennis elbow? What about my heel? Well, again, the experts on this show would agree. You start with the most conservative things. You don't jump to things that require, injections or anesthesia right away. You do exercise. You see your chiropractor. You get joint mobilization. You get physiotherapeutic modalities like ice and frictional massage and microcurrent, things that will speed up healing. And you do that first before you consider more aggressive things. But again, here, you don't jump from in-office procedures like that we talked about with chiropractic and physiotherapy and immediately jump to surgery. In between there's a very effective procedure called shockwave therapy or extracorporeal shockwave treatment. And again, if you want information on that, you call me at 866-521-SHOW. I can tell you all about it, or you can go to my website at drcremata.com, and you'll get an idea of why I'm so excited about these intermediary procedures when your in-office treatment doesn't give you the results that you want. So this is the shockwave therapy is a great intermediate thing that will get rid of probably 80% of patients before they consider surgery or injections or things that are more appropriate. And for heel pain, for example, it's really the same thing. There's a lot of neat things available for heel pain that will make it in the office, so you don't even, you'll rarely have to have surgery, and actually you'll rarely have to have even shockwave procedures, which are sort of these intermediary procedures. And Dr. Marwala discussed this at some length, but essentially one of the things that helps a lot with heel pain or with plantar fasciitis is to get orthotics done. So yes, you're going to want to see a chiropractor or a podiatrist. You're going to want to get some physiotherapy in there, some frictional massage, some exercises, some ice, and those types of things. Again, the more conservative, the better. But you're also going to want to put in custom orthotics. If you have any sort of flattening of the feet or hyperpronation, that amount of stretching to the plantar fascia is going to inhibit your ability to heal properly from that condition. So don't be afraid to go right away, if you have hyperpronation, to consider these heel lifts, whether or not heel lifts, but the custom orthotics, which actually are arch lifts. It's something that you want to correct to prevent the plantar fasciitis as well. So you've done the exercise, you've done the physiotherapy, you've done the orthotics, and then 6 months goes by, certainly. That's the point where you stop and say, okay, where do I go? Do I want cortisone injections? Well, Maybe not yet. It might be a little early because that can sometimes lead to tendon rupture in some patients. So you don't really want to take that risk so early. But the one thing I would recommend is the shockwave therapy. And then in the unlikely case where that doesn't work, then we might consider the surgical approaches available for these types of condition. So hopefully that gave you a little summary of just some examples on how always think most conservative to most aggressive. And don't forget there's a lot of stuff in between there that should be considered before surgery, drugs, and injections are considered. Okay, we are out of time for this segment. You're listening to the Dr. Cremata Show on KNEW 910 on your AM dial. Stay tuned and we'll be right back. We're back with the Dr. Cremata Show, and today we're doing our quarterly summary where we're basically going through some of the health concepts and going through some of these significant information that the experts that we have had on the show have tried to give you that you can incorporate into your life. So this is one of the podcasts that I hope you will refer to on my website on a regular basis or refer others to, because it's sort of the summary. If you can listen to this over and over again until you've implemented all of this information into your lifestyle, there's no question that you're going to get some very significant benefits from the information that these experts bring you. Now, one of the experts we had on the show is an expert on healthcare trends, and his name is Dr. Jerry Clum. And like all of these other guests, his podcast and his information is available at drcremata.com on the radio show tab. Now, Dr. Clum basically discussed this national health crisis, and questions that were asked to him included things like, what about the Obama plan? What about the McCain plan? And he just basically took the position of saying, look, those are just Band-Aids. Here's what we need. If you look back in the past, we've tried to solve our health crisis and our escalating costs and the death rates that we have from cancer and from heart disease. We've tried to solve that initially with treatment. So we said, well, we need better technology. We need more sophisticated, more expensive equipment. And we followed that line of thinking for about a 10 or 15 year period and failed miserably. That didn't do the trick. We didn't have less disease. We didn't have less costs. So then we went to prevention. Then we went to early detection. And we said, well, what if we're able to detect the disease earlier? Wouldn't that allow for better treatment? Well, it did allow for something called 5-year cure rates. So with a lot of diseases, when we started detecting them early and treating them earlier, it appeared that we were getting better results because more people with the disease were living 5 years later. But a really good analysis of that shows that the only reason that they were living the 5 years is because we identified the disease earlier and started counting earlier. So that early detection really isn't going to solve our problem, did not decrease our costs. So where are we at today? What does the data tell us? What is it that we've learned from the past as to what hasn't worked? Well, we're down to personal responsibility and prevention of disease. Not treatment once you get it, not detecting it early so you can treat it at an earlier stage, which, of course, is helpful in some cases. But the key to our healthcare crisis is prevention. It's taking personal responsibility for your 5 factors of health. For treatment choices that you make that are conservative, you don't go out and spend a bunch of money on surgeries, for example, that are not necessary. It's what you eat. It's whether you smoke or not, whether you drink too much. And in Dr. Clum's words, he summarized it 3 ways. He said, in order to prevent disease, you have to think right, you have to move right, and you have to eat right. And think about those words. When he says think right, he's talking about what we talked about earlier in the show. What leaves the brain in the first place to control function has to be correct. Stress has to be reduced. The beliefs that you have can change your physiology, can change the expression of your genes. So your mind has to be right for you to be healthy. Then you have to move right. We talked about that already about how important it is to keep joints flexible, to keep them lubricated, and the joints that move right are the ones that are less likely to irritate the nerves between the vertebra and help keep your nervous system healthy, and in turn keep the rest of your body healthy where those nerves go. And lastly, he said you have to eat right. And again, there's no question that the dietary changes that we're recommending, which are relatively simple, it's less animal protein, more fruits and vegetables, a diet supplement, nothing rocket science. We're not asking you to not eat things. We're just asking you to cut down and to eat more of other things and take some supplements. So these are the things I think we can summarize from Dr. Klum in terms of how we can help with our own health and really the solution to our national health crisis. Now, next we'll go to Dr. Lieberson. Now, Dr. Lieberson was the neurosurgeon that trained at Stanford University that basically introduced us initially to the concept of conservative to aggressive. And one of the things that he stressed is that before you consider neurosurgery, before you consider spinal surgery, of course you should try all other conservative measures. You should see a chiropractor. The chiropractor should give you exercises. You should try physiotherapy. You should try exercise programs. You should lose weight. If you consider surgery at all, you need to stop smoking because smokers don't do well with surgery. So Dr. Lieberson was the one that basically said do everything before surgery, and then he went on with more specifics about surgery, telling us that that neurosurgery, spinal surgery can work pretty well with extremity pain, but it doesn't work very well with central pain. So if you have a chronic low back pain, you're much better off sticking to conservative measures longer. Whereas if you have an extremity pain, what's called a radiculopathy, like numbness and tingling in the hand, sometimes, particularly in a younger person, that's where neurosurgical techniques can be effective, but only when the conservative measures failed. And the other thing Dr. Lieberson mentioned, he said, look, don't go into surgery lightly. There are risks from the anesthesia. There are risks from the procedures, and get a second opinion consultation. From my conversations with Dr. Lieberson, the things that I realized is that the quality and skill of a surgeon is everything. The results do vary based on who does the procedure. So that's an important concept to keep in mind. Okay, next, if you recall, and again, podcasts are available on my website, we interviewed Dr. DeBold, who is a public health expert on vaccination. And to summarize what she taught us and how it can affect our health and the health of our children, she first said that, hey, vaccination concerns are real. It's not really wise. Now, we're talking about a PhD in public health that sits on FDA committees for vaccinations. And she's coming in and telling us that, there are questions that you should be asking about vaccinations, that vaccine reactions are underreported. Frankly, I was surprised to hear that, in her estimation, between 90 to 99% of vaccine reactions are not reported. So when you're going to make a decision about having a vaccine for you or your child, how can you really do a risk-benefit analysis when 90 to 99% of the risks, in a sense, the side effects, the response or the bad responses to the vaccines aren't even in the mix. They're not even available. We don't even know what they are. So keep that in mind. Vaccines are not something that you just blindly take and follow whatever a particular doctor tells you or whatever's published. I believe Dr. DeBold, if she told us anything, was real clear about making sure that we were smart about individual vaccines, which ones we might consider taking or not taking. Also, how you should take them. Remember that other countries use less vaccines and they start much later, and they have the same safety profiles as we do. So there's some question, if you do decide to have all of the available vaccines, whether or not you should have them at the recommended schedule in this country. And so that's the alternative vaccine schedule she talks about. And lastly, she, was specifically questioned the use of, for example, hepatitis B vaccine in infants. She said that that's one that a lot of physicians and a lot of patients are questioning because, infants are not at risk for this disease. Do you really want to start vaccinating with an additional vaccine so early? Later on in the show, we covered an article on HPV, or human papilloma virus, for girls, and a lot of experts, including the experts that talked during the articles, or the experts that gave opinion during the articles that we covered, are suggesting that you don't have the HPV vaccine. The meningitis vaccine was of a particular concern because there was a recommendation that children 2 through 12 years of age shouldn't have it. And that's because the experts in the vaccine committees are saying that even though it's available and it's being, it is available for children, that we know that the risks far outweigh the benefits of the meningitis vaccine, at least in the data that we have for 2 to 12-year-olds. So the different experts that we had have been very consistent. Start with the most conservative. Don't take these procedures and recommendations blindly. When you listen to everything that they said, look at what they have in common. Go from conservative before you go to the more aggressive. And it all comes down to basic lifestyle changes. Eat right, move right, think right. Chiropractic first, drugs second, surgery last. Okay, we are up against a break. We'll come back with more of the quarterly summary on the Dr. Cremata Show in just a few minutes. Thanks for staying tuned.
Hi, this is Sarah, and I adopted my best friend Lulu from Tri-Valley Animal Rescue Group in Dublin. We love Lulu, and she's part of our family now. And she loves to sit up on the couch with me and put her head in my lap. Lulu is always smiling. So when you're ready to add a dog or cat to your family, call Tri-Valley Animal Rescue or go to petfinder.com to find an animal rescue group near you. They all deserve a second chance.
We're back on the Dr. Cremata Show, and we are doing our quarterly summary today, which means we're essentially taking the last 12 shows and trying to summarize some of the information in a format that you can listen to the podcast of this particular show repetitively to be sure that you incorporate the information given to you through the last 12 shows and from the experts that were on these shows. So let's jump over to what Susan Rhodes, the information that she gave us. Susan Rhodes has a practice in Fremont, California, and she is both a registered nurse and a marriage and family therapist. Now, she came in to discuss chronic pain syndromes, which is her specialty. And one of the things that we talked about with her is that all diseases have an emotional or a psychological component that should be addressed. And with chronic pain syndrome specifically, since pain is not a true sensation, it's actually an experience of a sensation. Some people can have a little bit of pain and it can destroy their lives. And some people can have a whole lot of pain and they seem to continue working and functioning. And we see examples of this. And for example, servicemen that get, very serious injuries, lose body parts, and they continue fighting. So there's different ways of experiencing pain that aren't necessarily directly related to the amount of a lesion. So what Susan does is she basically helps you with coping mechanisms. So when people have chronic pain syndromes, the answer is not to just take more pills or just, keep getting more exercises or more adjustments or more surgeries. The answer in many cases is to sit back and say, okay, how else can I develop coping mechanisms so that my brain can better adapt and I can function better in spite of my pain? So one of the main things that Susan gives us is this third component of saying, yes, you might need drugs. Yes, you'll probably need chiropractic care for a spinal condition, and it's the best way to go. Again, very conservative approach. Yes, you should take personal responsibility. You should exercise. You should take supplements. You should take anti-inflammatory agents like omega-3s. She tells you all that, but her specialty is addressing coping mechanisms for the pain. What's really cool about what she does, what's really effective about what she does, is she allows a lot of people to become more independent and allows a lot of people to lead more normal lives, because if they can manage their pain better, they require less drugs. And with less drugs, they're more alert, they can drive, and they can do more things. And the last thing regarding what Susan brought us is neurotherapy. And I was pretty excited about this procedure because neurotherapy goes beyond the talk therapy or the teaching coping mechanisms and actually documents condition. You can actually, with the computerization and the sensory electrodes that she uses, she could actually look at a pattern of your brain and identify specific abnormalities, and you can see on the computer and monitor your progress as these brain abnormalities are normalized. So with this neurotherapy, it's an objective way to tell whether people have anxiety, depression, different attention deficit disorders, brain trauma, and I think very importantly, allows you to objectify the condition and monitor treatment and change treatment along the way if things aren't going well the way they're supposed to. So Susan, I think, offered us a very valuable part here for chronic pain patients, and no one in chronic pain taking medications and doing other risky things should go without a consultation from someone like her that specializes in these procedures. So as we move on down, we see that our next guest, there's three guests that we can sort of cover together. They all came in with very similar information about general health and anti-aging in particular. And anti-aging in this last quarter was big. We had a lot of interest in it, and we had a whole segment on the show on it because of the interest in anti-aging. And if you recall, Dr. McCrory was one of our guests, and of course he practices in Roseville. If you need his particular services, that's MC capital CRORY, and his podcast and the references that we discussed are available on the radio show tab of my website, like all of these podcasts are available for you at drcremata.com. But he was very consistent with the same health recommendations that all the other experts have given you regarding diet and regarding supplementation. He brought in one other interesting one, and that was supplementing with iodine. And one of the things that he felt was important, particularly for women and particularly to prevent breast cancer, is the use of iodine. So if you have more information about that specific or if you have concern about the use of iodine or reduction of breast cancer, please contact Dr. McCrory so that he can advise you accordingly regarding appropriate dosing and such. And most of what he came in for is we asked him to cover the use of hormones for health. Earlier we talked about how hormones may be necessary for some cases of menstrual cramps, and also for hormonal treatments. So if people are low in thyroid, or they're low in testosterone and low in estrogen, it can have some very significant ill effects on their health. And someone like Dr. McCrory has a specialty in identifying these abnormalities and monitoring appropriate, safe progress. Dr. McCrory also talked about hormones for anti-aging. There's certainly a huge benefit for people that are deficient in either growth hormone or particularly testosterone for men, that if you get the balance of testosterone up, or in some cases, if you get the balance of the human growth hormone up, it can make very, very dramatic changes in the way that they feel. Some of the signs of aging, the lower energy, the less muscle mass, the skin that becomes thinner, are due to lowering hormones, which happens normally as we age. And Dr. McCrory's point is you don't really have to feel those symptoms of aging because it's very safe to use bioidentical hormones to get your levels back up to where they were before. So he brought in a very important part of anti-aging. We then move over to Dr. Riopel, who Dr. Riopel I thought did a wonderful job. And again, he practices in San Ramon, California. And he talked about the intermediary things to do for anti-aging and for general health. Yes, he agreed with all of the other experts. Take supplements, take omega-3s, take antioxidants in your supplement, exercise a lot. He definitely lives what he preaches. He is someone that exercises on a regular basis, eats right, lots of fruits and vegetables, everything everybody else has told you. The reason he came in is when that's not enough and you don't like the wrinkles around your eyes, he provides Botox, for example. It's a non-surgical, relatively conservative approach. And if you go to his website or just call him, it's Dr. Riopel, Riopelle, in San Ramon, California. He can guide you to the information of the 30 or so procedures that he does before you consider surgery. Again, from conservative, Dr. Riopel is our intermediate person here that talks about things like thermage to tighten skin, talks about minimal thread facelifts. He'll do things like liposuction. He'll do things like the Botox injections that we mentioned. And on a more conservative note, he'll also recommend the appropriate sunscreens and different skin creams that can help to rejuvenate skin and sometimes reduce surface wrinkles. So I think that Dr. Riopel is an excellent resource for those individuals that say, hey, I'm taking good care of myself. I'm exercising like crazy. I'm eating right. And I look in the mirror and I just don't like seeing that sagging skin. And it just bothers me to see the wrinkles. I don't feel that old. I don't want to look that old. So Dr. Riopel is a great resource for more information on that. And then lastly is Dr. Romano on this issue. We baby boomers particularly don't want to look old and we don't want to feel old. Sometimes looking old makes us feel old. So in a sense, the end of the line is when you say, okay, I've done the conservative things, I've done the intermediate things, but, I need something more. And Dr. Romano is probably, one of the premier cosmetic and reconstructive surgeons practicing in Fremont, California. And he is one that looks at the more aggressive things like the facelifts, the breast augmentations, the more aggressive liposuction procedures, the abdominoplasty known as tummy tucks, the procedures done around the eyes, the lifts, and things like that. So you've got this whole. You can start from the very beginning, from basic things, eating right, supplements that they all recommend that you do, and when necessary, you can end up with the surgical procedures. So we are almost out of time here. Again, website, drcremata.com, DRCREMATA. And remember that everything we're talking about can be found on the radio show tab. You'll be able to download and listen to this particular summary on a regular basis, and I hope you do, and also go back and listen to the experts if you have an interest in a particular subject or if you missed that particular show. If at any point you have any questions for me or you'd like a second opinion from me, feel free to call 866-521-SHOW or follow the email link on my website to email me a question. I am available for no-charge consultations either over the telephone or at one of my 6 offices. I hope that this summary of information is something that will help you lead a healthier and happier life, and I appreciate your attention while listening to this program.